Dr. Patterson here, and in this video I'm going to talk about what you would consider cosmetic, and I look at this as totally medical in nature. Okay, so we're going to talk about why you get on the scale. You get on the scale because you want to see how much you weigh. What you consider being overweight in many cases is considered to be, by you, your opinion, is something that's cosmetic. It's not related to your health. But I look at a couple things. Okay, so when you weigh yourself, what are you weighing? What are you looking for? You're looking for what the fat content is that's not good. So, and then you're also going to contain quite a bit of water. So you're probably carrying, if you consider yourself overweight, about 4 pounds of water weight, male and female. And then you start to get down to the fat layers. And there's two types of fat. So we're going to look at this fat layer right here. This is greater momentum, and so it's fat. But let me turn this so that you can see it. So this fat here is very, very thin. What happens is that this fat starts to protrude out this way, okay? And this can come out to be about, and I've seen it in certain surgical cases when I was in on surgeries where they open up this area here for, I'll just say various reasons. Anyway, it could look like a shag carpet. It could be 4 to 6 inches of this kind of fat, belly fat, right in here. This is visceral fat. This is the dangerous fat. So when you get a lot of fat in this area here, that is dangerous, okay? Because if it's here, it's going to be here. This is really dangerous because we're talking about, in many cases, non-alcoholic fatty liver disease, where this liver is caked with fat, see? And so you'll see sometimes your liver enzymes might be elevated as a result of fatty liver disease. You can actually get fat around your heart. Okay, so many cardiologists who are surgeons will see fat around the heart. That's a dangerous thing. So fat around the heart, fat around the liver, fat in the abdominal area, protruding fat, that's called visceral fat. That's the kind of fat that's dangerous fat. You end up dying with some sort of debilitating disease, and it shortens your lifespan. What you want is subcutaneous fat. And see, this, going back to visceral fat, you don't want that visceral fat on the inside of the thighs. And when a woman can lift her arms up and she's got fat around here, that's what we call visceral fat. Okay, where you can shake the arms here, that's visceral fat. So you don't want that. What you want is subcutaneous fat. Subcutaneous fat is what I would call, I'm gonna turn this around so you can see it. Okay, you want buttocks fat, okay? And you see this in many women. A lot of it has to do with, believe it or not, your food, your diet, your genetics, your topography, the area where you come from. And we notice that the most, and I'm not talking about intimacy here, we're talking about anatomical structure, okay? If you have subcutaneous fat, okay, what we call big buttocks fat, that's good fat to have, because basically we notice that women who have that type of fat actually live longer, or they should live longer. That's good, safe fat to have. So this model doesn't demonstrate the type of buttocks that I'm looking for in terms of fat. It should be out this way round. The other thing is that I often say is that when you look at something that's cosmetic, you might see puckers in here. Okay, what you call cellulite, that is not cosmetic. Okay, cellulite fat in the buttocks, especially in a woman who has a large buttocks, okay, and now you start to see what you call craters, or you call cellulite. This is what you do. You go back to the liver. You got to detox your liver, detox the large bowel, okay, because what's happening is that you're getting inflammatory changes taking place. And so there's a release of certain cytokines. What happens is that your buttocks, the fat cells, start to leak. It's just like the gut. When the gut leaks, it's going to leak out toxic materials. When the buttocks fat cells leak, they're going to leak out toxic materials. And this toxic material is going to take away from the smoothness of the buttocks. And so you can see and let me just go back to this area one more time. Like I said, this is not talking about intimacy. This is really talking about structure and physiology. Okay, so when this starts to become distorted, all right, with cellulite, you know that you have problems with your liver and your colon. And then that means you also have hormonal dysfunction or disruption in those organs that secrete hormones. So that's got to be balanced out. And the reason I can tell you this here from experience is because when women go on a detox or they go on a fast, then what happens, we see that the buttocks start to smooth out. And so you see the black woman has the largest distribution of fat, subcutaneous fat in the buttocks area, followed by Indian women, followed by some Asian women, and then the Caucasian women. And many of the Caucasian women who has the subcutaneous fat where they have smoothness and roundness are not in the United States. They are basically in countries where the food doesn't contain a lot of the highly processed, chemicalized foods. So what we do is take that patient off and we target the liver. You know, here's where you need supplements in this country. And in other places you can use, you can go with the food, okay, because they don't have foods that contain as many chemicals as we do here. So we're looking at, you want to add milk thistle or silymarin, choline. We use a lot of choline for gallbladder and liver, sluggishness as far as the bile is concerned. Your liver makes the bile, it's stored in the gallbladder. N-acetylcysteine, alpha lipoic acid. These are some supplemental suggestions that you can use to start detoxing your liver. And then, of course, along with enemas and colon therapy, and then you want to use certain colonic, certain colonic herbals to help push this through, this waste matter. And once you drain, you get the drainage of the inflammatory products, then you'll begin to see, and we've seen this, it takes about 3 weeks, okay? This will start to smooth back out, and then the cellulite will disappear, okay? So what you want to do is make sure that you have a program or someone who can, and what I just gave you is very, very basic, a program where you can do this, and it should be supervised because you need several different things. Okay, so like I said, this is not representative of what I call a subcutaneous fat here, just small for anatomical teaching purposes, but I think you kind of get the picture, you know what I'm talking about. Okay, best in health.